Good afternoon, welcome to the Health and Wellbeing Board. Hope you're all well today, and we're nice and toasty in here, aren't we? Even though it's a bit chilly outside. Just reminding you that we are being live cast, and could you make sure your phones are on silent? First, businesses to ask if there's any apologies, Jenny?
Yes, Chair. We've received apologies from Richard Parry, Sean Rayner, Tom Brailsford, Stacey Appleyard, Nicola Goodberry-Kinane, Christine Fox, Liz Mear and Len Richards.
And we'd just like everybody in the room to introduce themselves so we all know who we're talking to. If you're subbing for somebody, if you could say who you're subbing for. Perhaps I could start at this end at the back.
James Cregan, social care providers from Kirklees Care Association.
Warren Gillibrand, representing University of Huddersfield.
I'm Catherine Riley. I'm from Calderdale and Huddersfield Foundation Trust.
Hello, I'm Carol McKenna and I'm Place Lead for Kirklees Health and Care Partnership.
Hi, Steve Brennan. I'm the Director of Partnership Development for the Kirklees Health and Care Partnership.
Go and pop onto the back just for you two, please.
Hi, I'm Jo Lawson, Chair of Health and Adult Social Care.
Hi, I'm Alistair Brown, Kirklees Active Leisure's Chief Executive and here representing third sector leaders.
Thanks. Pop on the front.
Hi, I'm Rachel Spencer-Henschel. I'm the Director of Public Health for Kirklees.
Hello, I'm Carol Patterson, Leader of the Council.
Hello, Chris Lennox, representing Sean Rainey from South West Yorkshire Mental Health Trust.
Afternoon, I'm Jim Griffiths. I'm District Commander for the Police in Kirklees.
Hi, Lucy Wearmouth, Head of Improving Population Health and bringing an item today.
I'm Alex Chaplin, Strategy and Policy Officer for Adults and Health.
I'm Jenny.
And I'm your chair, Beverly Haddy. Minutes of the last meeting. Can somebody who was here at the last meeting move those as a correct record, please? Alistair, yes?
Yes, I will. Yep, thank you.
And seconded, Carol. Does anybody have any interest to declare today? So, we have the first items on the agenda to be considered in public, and then we'll be going into a discussion in informal session for the final item. Sorry? That's what I'm doing. Yeah. So at the moment we're in public session, and we'll be staying in public session until the final item when we're having a discussion session, an informal session together. Is there any deputations or petitions received, Jim?
None, Chair.
And have we received any public questions?
None, Chair.
Right, then we move to our first substantive item on the agenda, and we have a presentation by the District Commander, Jim Griffiths. He's going to be talking about safe zones, so I'll hand over to you, Jim.
Okay, thank you. I've brought a PowerPoint with me. When I was asked to do this, I did think, I wonder how long that's going to take me, because it's a really simple concept that I was hoping that it would be an easy thing for me to do. But actually, when I started looking into it and just had a chat with the people who were delivering it, it's perhaps a little bit more complicated, just the setting up of it. But ultimately, I do want people to still remember that this is a really simple concept, and that's exactly what we want it to remain. So I'm going to talk to you about safe zones, and that first slide, and I'm hoping that people are starting to see that logo in different places around Kirklees. I've certainly seen it in more places recently, but I am looking out for it. But if you've not seen it, please do look out for it. And that's what we're going to be talking about today, that the safe zones around Kirklees. And it's probably worth talking about where these came from and how we ended up with in the safe zone concept and then delivering it. So I've put up there that it was in development since 2019. because in 2019 I had a conversation as part of a focus group with some young people at one of the schools in Huddersfield as part of the Children's Safeguarding Board, as it was then, what they would like us as a police service to do more for them. And one of the young people said that there is nowhere to go if you are feeling unsafe. And it was an interesting discussion we then had around how do you know that the people that you are approaching, how do you know that the locations you might go in for help are suitable. And so we took that away. Now, I put 2019, I think it was sort of December 2019 that we had that. So, as you can imagine, quickly that got overtaken by other things that happened in 2020. And it has taken us a while after that to sort of get through and recover and pick this up. But what we have done now, I think it has been picked up, and we've developed it quite widely across Kirklees, and I'm really quite pleased with where we've got to with the safe zones. So the ambition of the safe zones was to create a network of these safe places, whatever they might be, so that women and girls particularly are provided with a place they can use momentarily retreat. But it's not just for women and girls. It did fit into our violence against women and girls agenda. So that was the area that we were particularly focusing on. But it can also be for vulnerable adults and for others who are feeling unsafe, can use these areas if they feel they just need to call in, or they need some help, or they need to just identify themselves because they're lost or something like that. It is to work with partners and make sure that everybody understands what the risks that people are facing. So what we saw was this was an opportunity to give people some better training around risks that we perhaps understand and think sometimes that everyone else understands, but perhaps they don't. And if somebody presented with some of those risks, would those individuals know what to do? And so we did think it was an opportunity then to share that and make sure that people did know what, and feel confident that they would understand in a very basic way what those individuals were saying to them and what they were presenting with. So it was actually asking for people to be active bystanders, wherever they might be, to actually take some action and help those individuals. And we did get a good response to people signing up for wanting to do the safe zones and wanting to do the training. So we did focus on the key areas in terms of West Yorkshire Police from our point of view: pursuit of perpetrators, creating safe spaces in private, public and online, and increasing trust and confidence in policing. Although I think the last one, it's probably not really about that, because it's more about safe spaces in communities. So whilst it hopefully will have an impact because people will feel safer in their area, which can only be a positive in terms of policing, it is more about communities taking responsibilities themselves and places within communities to take responsibility for helping people in their hours of needs. So I've mentioned about what we wanted to talk through in terms of the safe zones and explaining to individuals, and how we train the safe zones is probably a good place to start. So talking about that active bystander and looking at how we can provide safe zones in what is an ever-increasing complex world. So making sure that people understand and have awareness of child exploitation, both sexual exploitation and criminal exploitation, debunking some of the myths, and it's a bit further down as well, around county lines exploitation and around what that means, because quite often I think people get confused about what exactly county lines is and who may be at risk of county lines. We use all sorts of terms such as cuckooing, which I'm not sure I'm particularly fond of that term, but it has become a little bit more well known recently, particularly for vulnerable adults and keeping them safe. But we will use things like that and just make sure that people are aware of how that might work, how that might impact on individuals, and awareness of grooming. And that can include both grooming there and then and what is happening then, but also we give a bit of an awareness of non-recent grooming and how people may find that somewhere like this may be a first port of call that somebody may open up. And it might just be that might be the place where somebody decides that they want to go and tell somebody about something. We talk about knowing the signs of across a whole range of incidents and crimes and behaviour that people may suffer from, and stalking and the complexities of what stalking is and the differences between stalking and harassment, and perhaps a police thing really around. We sometimes get the two confused within policing, and realistically, stalking. I think when you think of stalking, I think we all have a picture in our minds around what stalking is, and that's what I want people to think of as stalking, because it is those very serious incidents where somebody becomes fixated with somebody, and it can often lead to tragic consequences. Domestic abuse, giving a whole range of training around domestic abuse, from very early signs of domestic abuse, right through controlling and coercive behaviour, right through to learning that we might get from domestic homicide reviews and situations where it has become in those most tragic consequences. And then we just explore the safe zone process to see if it's right for everybody, because it won't necessarily be right for everybody, and everybody won't always have that opportunity. And we have had some people come on the training thinking that they are going to be able to run a safe zone and realise that perhaps it's not for them. And I would prefer that, for them to say, actually, I don't know if we're going to be able to commit to this in my business, in my building, in my wherever it might be. So they have stepped away, and that is also fine, as well as those people who want to do it and want to push on with it as well. So we talk about what they might be used for. It might be for people feeling unsafe. It might be for people being followed, people who are lost, bullied, missing, and that final one, which is a focus of this presentation, I suppose, around violence against women and girls. But it doesn't just have to be for that. It's any area where somebody might feel unsafe. They can go into one of these locations and seek refuge with it. So there are different levels of for each of these. Oh, that's why it's not come up. They're all in little extra clicks. So different levels of support that individuals might find themselves in when they go into these safe zones. So it might be somebody who just needs momentary support, a low need, maybe just a word, just somebody, a friendly face, somebody who to talk to. That is exactly as it says, a momentary retreat. It might be a medium need where some assistance is required. Those individuals might need signposting to some other safety point, some other place. They might need some assistance with a phone call. They might need to call in another agency. They might need to help with that. Or they might need a taxi or some wider transport that might help them get to where they need to be. Or there's an emergency response where there's a high need, an immediate threat. It is urgent, and there is likely going to be a crime committed in those circumstances, where I would expect in an emergency response the individuals in the safe zone would be ringing the police via 999, and we would get to those people within 15 minutes, which is our requirement from calling to us actually being there and with those individuals. What we also expect from the safe zones is to record and keep a log, a note of everybody that comes in, so that we can revisit, so that if there is an incident or a crime or something else in the future, and it's particularly to us and particularly for us in the criminal justice process, that somebody might say, well, actually, I went into a safe zone at this location at that time. It gives us the opportunity then to check if they did, and it should be recorded. If they've got something that they've concerns through that training that we've given, then we welcome people to share that, whether that be by ringing us or through the Partnership Intelligence Portal. That number of these have been encouraged to sign up to and share intelligence with us, so that they can that it can feed through into the system, and if it needs acting upon, then we will act upon it, and respond by passing on information and concerns that you've witnessed, and exactly that, becoming an active bystander, not actually watching, as happened when I was walking through town the other day, and lots of people were watching an incident that I ended up, as you would expect, having to intervene in. But there was lots of bystanders, not many active bystanders. So it's encouraging people to have that active bystander approach. So this is where they are right now. And just sort of conclusion, we've got currently nearly 200 safe zones across Kirklees, 38 rural, 43 in Batley and Spen, 50 in Huddersfield, 35 in Dewsbury and Mirfield. There are also, the libraries have signed up. There are some GP surgeries have signed up. We have got some pub chains who've signed up, some of the bigger pub chains across Kirklees who also have places in Kirklees that have signed up, and there are some other wider, bigger organisations who have signed up that add to those numbers. What we're currently doing is working with the WalkSafe app to add them to that app, so that if you go on the WalkSafe app, it will show you where those safe zones are. So if you are feeling unsafe, then you can identify one of these locations without having to look for the badge, and have a look and see if there is one nearby that you can just call in, knowing that those individuals within there might be able to help you and give you that advice because they've had that extra training. Just at the moment, we have been focusing on the rural areas in Kirklees, particularly Holmfirth and the Colne Valley, because we've got not as many up there. And we have just had a little bit of a push, which has pushed the numbers up, because there are some people that want to do it, and we've had quite a few individuals who have written to us or made us aware that they'd like to get involved, and we'd like to spread it a little bit further as well. So that's it.
That's great, thanks Tim. That sounds really exciting that you've got so many signed up, but clearly there's always scope for more. Has anybody got any questions? I know I was interested in, how can people get involved? Do they approach the police directly, or is there a specific route?
Yeah, it would be to approach us directly. There is, which I will share and I will ask to be sent out with the minutes, there is an email address to our crime prevention officers who are the ones that coordinate all of this, and they're the ones that will be able to access it for people.
That's great.
Thank you. Thanks, Jim. That was really interesting. You'll be aware that there was a report, I think it was on the BBC in the last few weeks, about the Ask for Angela scheme and how few pubs were actually aware of this, even though they advertised it publicly. I just wondered if organisations are signing up to this, what do they need to do to make sure that with staff turnover or the passage of time that they remain up to date in terms of all their staff knowing what's required of them?
Interesting, the Ask Angela one. We are really proactive in Kirklees. We're lucky to have some really proactive crime prevention officers who do check with the Ask for Angela as well. We do regular, almost like, and we've been using our cadets to do it, but almost like test purchasing within Kirklees to see if those individuals, so we do our own, we don't wait for the BBC to do it for us. We do our own, to just check if individuals do it. And the plan is to do some of that with safe zones as well, just to see if individuals, and then we've got newsletters that we send out to all the safe zones. That goes out so that they will all receive that, and then they will see that we've been just checking people's knowledge. It's not the same probably as Ask for Angela, because that's a little bit more of a responsibility that those individuals have got. This is more just checking that they've got the support they need within those safe zones, and if there's, like you say, if there's staff turnover, they need a bit of a refresh, we'll happily do that.
Rachel?
Yeah, thanks, Jim. Really, really interesting. And I just think it's going to be one of those things that would make our district better, which is fab. I was thinking more about the data, because I was thinking about how if people are recording sort of the sorts of things that are causing issues for people, how do we kind of use that to be a bit more preventative? Because we could then potentially get either key messages out into some of those communities if there's some common themes, or also help with, so for some of our community staff, for example, to be able to almost actively tackle some of those issues within the community. So it'd be good to be able to think about how we might share the, not obviously the specifics, but the themes that come out of that engagement, so that we can perhaps use that to help to counter some of those issues in the first place.
It's a really good point, actually, and they all do it, record it differently. So it'd be nice to have a central deposit sort of location that everybody can feed it in, and then we can pick up those themes, which I will ask our crime prevention lead to just have a look at and see if they can progress that. Thank you.
Did you have a question, Alistair?
Yeah, thank you. Thank you for the presentation. I think there's a huge role with this kind of work for the voluntary sector. Yeah, third sector leaders, Kirklees Youth Alliance, the CAL sites, you know, they should all really be signing up to Safe Zone. So more than happy to have that conversation. But also as well in terms of spreading the word about what Safe Zones are, so that individuals are aware of them and where they are and can make use of them as well. So we'd certainly be very interested in having a conversation and see what we can do and providing the training if we can roll that out as well.
Yeah, that'd be useful. Thank you.
Yeah, I'm just thinking from, excuse me, from a social care perspective as well. There are lots of, we have got lots of buildings across Kirklees in care homes, etc. And I'm wondering how we can perhaps open up some of those to become much more integrated into the community and become safe zones. So maybe that's another conversation we can pick up as well.
Yeah, absolutely. And any building that is, because some of those will be in different locations as well.
Absolutely.
Which is
some very deprived
exactly beneficial
well, so.
for us to get into some of those other areas where we perhaps haven't got safe zones at the moment.
Yeah, okay, well, I'll reach out on that one.
Thank you.
Thank you. I was thinking that this will specifically fit in with the push we're going for in the new year, because having somewhere safe to go makes people just have that feeling of safety, well-being in an area. I was going to ask you, are there specific types of places that you've not got on board? You know, have we got shops? You've mentioned pubs. We've talked about the health settings now. Is there anywhere else that, you know, that the people in the room might be able to offer you safe zones in that you've realised you're not really pulling in?
It's a real mix of places. The list that we've got, you look through it and think there isn't really a correlation in where in any of those areas. There are a lot of shops in town centres, for example, or cafes, things like that. But out and about in the rest of it, there's all sorts. There genuinely is all sorts of buildings and locations that have signed up. So there isn't a gap, I wouldn't say. It's just a wider gap, that there is a gap that we'd like more in lots of different areas. So everybody's welcome. I think that's the message.
So maybe the odd spots in geographical areas.
Yeah, definitely.
Do you think you could put something together, Jim, that I could send out to the members of the board and then they can follow that through directly to get in touch?
Yeah, absolutely.
That's fantastic. Yep. Thank you, Jim. We've got a couple of people in the room that didn't get to introduce yourselves. Would you like to introduce yourself? And
Hi, I'm Matt England. I'm Associate Director of Planning and Partnerships from Mid Yorkshire Hospitals Trust.
Thank you. I will move on to item number 8. And this is going to be an update on the... Oh, gosh, I've written all over it. That's typical of me. This is from Lucy, and have you got the agenda there? Yeah, it's the local plan. Just an update, basically, isn't it, Lucy?
It is, although my partner in crime is currently not here yet. So I can start, but I do need her for some of it.
I think we're not able to jump ahead either, are we? We haven't got... Julian Townsend's not here either. Could you start, Lucy, and then we'll see where we get to?
Yeah, let me just share my screen, hold on. Right, good afternoon. Hello, for those of you who don't know me, I'm Lucy. I work in public health. I'm head of improving population health. And I am here with my colleague who's going to talk to us today about the local plan in Kirklees. This feels like a really important thing to bring to Health and Wellbeing Board. I don't know if in the last iteration of the local plan it did come here, but myself and planning colleagues thought it would be a really useful thing because obviously healthy places is one of the main priorities for the health and wellbeing strategy, and there's obviously a number of organisations in the room who we want to consult with as part of the local plan process. So in terms of the local plan, it's currently in that early engagement phase at the minute, so there's still plenty of time to feed back through the process, and we really wanted to bring it to you today so that you can have the opportunity to find out more about the local plan if you've not been involved in it before, but then also for us to think about how you can contribute to it as well. Okay, so you'll be familiar with this, just to kind of set the scene really about why we've brought this here. So this is the Kirklees Health and Wellbeing Strategy. Healthy places is a really important theme within that. And then this is the ambition for the Healthy Places theme. And the ambition is that the physical and social infrastructure and environment supports people of all ages who live, work or study in Kirklees to maximise their health opportunities and to make the healthy choice the easy choice. So you'll understand there's obviously loads of massive connections between the planning world and public health and health. So that's why we're here with the local plan. We already do a lot of work with planning colleagues in Kirklees. We have, I think, a really good relationship. It really is like pushing on an open door in terms of making those connections. So we're here to talk about the local plan, but obviously there's a lot of work which is happening already within this space. So we just wanted to set the scene really in terms of some of the things which are already happening and how the planning system can support health outcomes. So I won't talk through the local plan because we're already going to do that. So we have something called the supplementary planning guidance. So this is guidance produced to support local plan policies, and we have ones in Kirklees for hot food takeaways and for open spaces as well. So just to talk through the hot food takeaway example. So in public health, we provide our planning colleagues with a tool which basically brings together a number of health indicators which help us to understand health within a particular local area. So if we have an application for a new hot food takeaway, we can basically put in the postcode of where the hot food takeaway wants to be, and we can understand what's happening within that local area, so we can see what are the levels of obesity, what are the levels of cardiovascular disease, diabetes, so other things which have an impact on health and well-being which are related to obesity. So if we have an area that has a significant, it hits kind of a range of different indicators, our advice would be that we need to consider carefully that application within that process. The other thing that we wanted to talk about was health impact assessment. So this is something again which already happened. So this is for new major planning developments within Kirklees. So when we get a planning application in for a major development, colleagues within the public health team will basically assess that application according to health, really. So we'll look at, does the planning application consider access to green spaces? Is it considering the local community around it? We ask things about air quality. So it's a really kind of broad audit, really, that we can undertake of that application, and then we give advice to the developers as well about things which they could kind of mitigate for in order to improve health outcomes for that particular planning development. Okay, so this is where Hannah was going to take over, so I'm going to do my best, and hopefully she'll turn up soon. So the Kirklees local plan update. So we have a local plan in place at the minute, and that was adopted in 2019 with an update which started in November 2023. The local plan is, if you haven't been involved before, or it's a huge process which, oh hooray, Hannah's here. Perfect timing, yeah.
So the local plan, our current local plan was adopted in February 2019, and we started an update. It was given a full council approval to update the local plan in November 2023. The reasons why we're updating it is set out on the slide. It was around our housing numbers, our job numbers, not meeting delivery on those, and climate change was a big thing, a reason why we're updating the local plan, which is set out there, and it is all set out in the report, the full council report, in November 2023. Next slide. So, for the planning policy team, one of the key roles is the production of up-to-date planning guidance in the form of the local plan. The plan has several purposes, including a vision for Kirklees, allocating land for development needs, as well as identifying designations for land to be protected. This can include urban green space sites, local green spaces, core walking and cycling routes, and the plan also provides a framework to guide decisions and planning applications. Next one. There are lots of elements, and I won't go through them all, but they are on the slide, that feed into the review of the local plan. So meetings like this is an excellent way to learn about local priorities, the needs of communities, and having an opportunity for us to learn from your experiences and networks. So we are guided by the National Planning Policy Framework. That's what the policies within the local plan are based upon. The guidance in the National Planning Policy Framework is that the local plan should aim to achieve healthy, inclusive and safe places which promote social interaction, are safe and accessible, and enable and support healthy lifestyles. So that's what the policies within the local plan should be aiming to achieve. You might be aware, or you might not be aware, that during the summer, the government consulted on an updated version of the National Planning Policy Framework. The chapter on promoting healthy and safe communities, there was no significant changes proposed to that chapter of the NPPF. A few minor ones, but nothing that changes the actual meaning of the policy. The government, the consultation for that's now closed, and the government are assessing the responses to that. The consultation did ask the question, how could national planning policy better support local authorities in A, promoting healthy communities, and B, tackling childhood obesity. So we did, as a council, we did provide a response to government on that question. I'll probably talk a little bit more about early engagement later on in the slides, but we have opened some early engagement, and through that local plan early engagement, we're seeking views on whether health can form a golden thread throughout the plan and in all policy considerations. Can move on here. We have to ensure that the local plan aligns with the council's strategies, so the health and wellbeing strategy is up there, and the local plan will consider that when we're doing policy formulation. So these are the current policies that are in the local plan that are sort of health related. There are quite a number of them, and they all do different things. I won't really go into the detail about them, but if you want to ask questions now or later about them, you can. As part of the local plan update, there is an opportunity to review the existing local plan policies and include further detail or additional policies guidance, potentially removing the need for, we currently have some supplementary planning documents, so we could remove the need for those, and add to these policies or amend them. So there's the opportunity for that to happen through the local plan update. This is just a bit about our evidence base. We have to, as part of the local plan update, we have to gather an extensive evidence base. I've just tried to list on here a few of them that are more related to health. These are just a few of the evidence-based documents that we have to gather. So that just gives you an idea of the policies within the plan are based on robust and up-to-date evidence. And this is just an example of that kind of thing. Yeah, and we work with partners, so we work closely with Public Health, Active Travel England, all statutory bodies. We do a lot of cross-service working within the council to formulate plans and policies, SPDs. Local plan timetable. So on Monday we launched our first phase of our early engagement. This is a really high level phase of engagement, and we do intend on doing a second part of early engagement April to May time next year. The early engagement that's out for consultation now is focusing on the vision, the local plan vision, and then the second phase of early engagement will focus more on sort of development options, not development options, development levels, spatial strategy, that kind of thing. The draft plan itself, which will have all the draft policies in, all the land development options in, isn't timetabled to be out for consultation until autumn 2025. I think that's... Yeah, so we do propose, I think it's in the report, that we'd come back to board maybe summertime to report back on the first phase of the early engagement. Yeah. Any questions?
Wow, well, we're flying through things today, aren't we? Sorry, we were a little ahead of schedule. That's why you weren't in there. We'll take a coffee break after this so people can fill their cups up so we don't scupper on the next item. Has anybody got any questions about the local plan and what it means? Any ways in which you feel like you might want to feed into this early stage consultation, or maybe later on?
Thank you so much, that's really helpful. I remember actually when it did come last time and we did have a discussion at this board, I think at that point we were thinking about understanding the impact on partners, particularly things like primary care, of having, you know, big new housing developments, and kind of what that would mean in terms of practice, you know, populations, and how we could kind of look at the planning of that going forward. So I think this is probably too early to do that, obviously, at this point, but I think for the board it's something to consider. Both there's the sort of public health prevention type stuff, but there's also actually what are the changes to services that might result from some of the proposals in the plans, because I know we would consider things like, you know, waste bin routes and the stuff for the council, but it's equally as important to look at it from the perspective of what the health impact would be of that. So I think this board would probably want a further conversation on understanding what that's likely to do to our landscape and what that might mean in terms of adding more demand into the healthcare system.
Alistair?
Yeah, thank you for that. I think it's really great that we can have health and wellbeing going through the local plan as it currently is, and hopefully that can be continued in the future. I think that's a fantastic aspiration to have, however challenging that is. Building on Rachel's point, absolutely agree that a key focus should be ensuring that we have preventative health and wellbeing measures in terms of housing developments, etc., that are developed in the future. I think having that balance there, and let's hopefully help people to not have to need formal healthcare services, but actually prevent them and actually encourage them to have a healthy lifestyle. Active travel, you touched on that a couple of times, is a really great example. If people feel safe and able to travel by walking, cycling and so on, then I think that that's a huge step forward, and that's the way that we should be thinking, planning for the future with that. Not just about housing numbers, as we're maybe being encouraged to do by government and so on as well. It's about how we make those housing areas as healthy as we possibly can, and that doesn't mean a small playground with a couple of items that no one uses. It means meaningful provision in those communities. So I think it's really important that we do that. A very specific one about Everyday Active, an area that I'm obviously involved in, that's probably now out of date, that strategy. So I think Rachel, as the Director of Public Health, there's the plan to do the physical activity review, is going to be the report for the summer of 2025, and then I think a new strategy is intended really from that. So the timing will hopefully fit in with you on that, Hannah, as well. But obviously I am a little biased, but I think that's a hugely important area to try and encourage people to be active where we can.
Thank you, Alistair. Do you want to come back with anything for Alistair on how that fits in? Are there any threads that are really looking at that that we need to maybe come back to at some point?
I mean, active travel is a theme that runs throughout the local plan, and we will have policy on that. So yeah, I mean, we're looking at it, yeah, and it's not just that as well, it's access to green spaces as well for populations, particularly in our more deprived areas. We allocate urban green space hopefully within certain distances of new developments. So we do look at things like that. We build on healthy communities. That's just one way really of doing it. But yeah, yes, we are looking at that.
Thank you. I have a couple of questions, but just before I go into them, just strongly agree with Rachel's point earlier about the need to understand those interdependencies, and we know the impact that large housing estates, for example, have on services in primary care and elsewhere, so having sight of that would be really helpful. But there's two things I wanted to ask that are a bit different actually. The first point was, honestly, when I was sitting here, I thought, it only feels like 5 minutes since we've talked about the local plan before, and then I looked and it was 2019, so it's like 5 years ago. But obviously an awful lot has happened to our society in those 5 years. And where would I go if I wanted to understand how much of that local plan in 2019 had been actioned and where we were against what was set out at that point? So that was one bit. Rather than, it sometimes feels like we continually refresh these things, but it'd be interesting to know where are we at a point in time against the last plan. And the other question I had is probably more for Lucy. You know, it was really helpful hearing about the, you know, can't remember the title, but the sort of hot food takeaway type example you gave, and health impact assessments against planning applications. Do we know if that makes any difference? So do we have a sense about how many planning applications may have been turned down on the back of those health impact assessments? So, 2 questions.
Yeah, before we decided to do the update, we did a full review of the local plan. So this was over last summer. We reviewed our housing delivery. We have to achieve a 5-year housing supply. I mean, this is all public, and I can provide links to all these documents if you'd like. But we did a full review, and we reviewed each policy within the plan, how it was performing, whether we think it needs amendments. So there's 2 aspects to it. There's whether the policies are actually working and delivering what they should, which in the most part we believe they are. Some might need a small tweak, but we believe they are working. But then there's the delivery side of it in terms of employment sites and housing sites. So the housing hasn't been delivered. All the allocated housing sites haven't been developed, and neither have the employment and mixed use allocations. So if that's the sort of thing that you're wanting to know, no, we haven't, and there's delivery issues on those. And then, of course, the council declared the climate emergency after we adopted the local plan. So that's another big reason why we're doing the update to incorporate climate change and climate change policies within the local plan. So yeah, do you want me to talk about the hot food takeaway SPD or? I don't know the numbers you might, and the planning applications, yeah.
So we reviewed, so the SPD is still relatively new, so we reviewed it this time last year to get a sense of how it was working. So the first thing to say is that this is for new hot food takeaway applications, because that's a kind of, I'm still learning about the planning world, but that's very crucial that it is just for new applications. And we have, using this new process, there's been, I think, 9 applications of new hot food takeaways, and 5 were rejected and 4 went through. And for some of those, and it's not just, they're not just rejected because of the kind of public health tool. There'll be a range of reasons why. But for some of those rejections, it was because of the evidence that was in the toolkit, probably combined with other stuff locally as well. So it is still very early days, but we see it as part of, I suppose, it's one way that we are working with planning colleagues to tackle the obesogenic environment. So, and we'll plan on doing another review this year. So. Did you want to add?
We have done another review very recently, but I don't know the statistics off the top of my head because we've only just done it. So we've done it September 23 to September 24. So there are a number of, we don't get many applications for new hot food takeaways that require a change of use planning application. But there are a few that have been refused of this last year, based on the toolkit, and there are a few that have had conditions that have been approved, but they've had conditions on restricting their opening hours because they were within 400 metres of a school. So it is working and it is being used.
Thank you.
Yeah.
Great, thank you.
That's you steered me towards the devastating information that was produced by Gateshead, wasn't it? About hot food takeaways and how they affect obesity and, you know, that walk to school past takeaways and things like that. I think we might be interested in hearing a bit more about the review at some point. But I think one of the things about the local plan, sorry, has anybody else got any more questions before the thing about local plan, and it talks about planning, and people don't realise that it is about a picture of the area rather than just planning, and it has impacts across it. So I think with our view to what we're going to be doing in January, and I'll mention this again at the end if you haven't been in the meeting, the last meeting when we talked about what we've got planned for next year. Although early engagement is open to everybody, I think it might be time when we come back to this in April and May when you've got the further placemaking look at the local plan, that might be a time after that when the Health and Wellbeing Board really might want to have an input, because we'll have started talking about what we're looking at into next year as a real strong placemaking tool. But I'm sure you'll be happy to come back then and talk to us some more, perhaps.
Yeah, I mean, the early engagement is open to everyone, so you can come in as a board or individually as a resident of Kirklees, if you are. And yeah, so that, and then we can come back in the summer and report on our findings from the first stage of the early engagement, and then yeah, we'll go into this second phase of early engagement then, which talks more about the development strategy, I suppose. So yeah, we can do that.
Yeah, that'd be great. Thank you. Nothing else from anybody? Right, well, I think we'll take a few minutes now for people to have a comfort break, because we're running quite ahead. And I know we've got Jill at the back. Have you got anybody else presenting with you, Jill?
No, I've been left solo.
Okay, well, we're not due for you for another 20 minutes, but we'll just take 5-10 minutes now. People can get a drink and a comfort break, and then we'll come back. 9, and we're going to take a look at the Inclusive Communities Framework with Jill Greenfield.
Thank you. Good afternoon, everybody. I'm just going to run through a few slides just by way of recap and start to talk about the work that we have done already, and then hopefully there'll be some time for some consideration. So I've just introduced myself there. So in terms of the Inclusive Communities Framework, it is one of our 4 top-tier partnership strategies, and that means it is a partnership strategy. It isn't just held by one organisation. Overall, it's a commitment for us to work better with communities, and really signals that in order to do that, we need to be able to change the way that we do things. It is our partnership commitment to be inclusive, and to really focus on inclusion across the district. And as part of that, when we pulled the ICF together, we did that in collaboration with a number of partners, including the VCS. So, just in terms of a really quick refresh, because I know many people in here have seen it before, but then there's a great big distance sometimes in between when we look at that again. This is really about acknowledging that some people in our communities, and we have seen this more recently, don't always feel like that they belong, that what matters to them isn't always important to other people, and they also just don't always know how they can get involved in their communities. So the ICF really offers an opportunity to give us that framework to be able to create safer and more cohesive communities, so people do feel like they belong, that people do feel like they can play part. But the focus isn't on our communities, in terms of who needs to do a thing, it is focused on how organisations and institutions actually work alongside our communities, and I think that's a really important focus. It has been designed so it can be used across the whole of Kirklees. That has been a challenge to make it relevant to every organisation, and particularly strategic partnerships, and I'll come on to that. But it does offer a guide really of how that can be done across services and partners, community groups and initiatives. And it is really important that we continue to focus on the best practice that we have. So the ICF is made up of 3 guiding principles: belief that communities have the solutions to their problems, they have the skills and the knowledge that organisations do not have. It's based on belonging, that if you build trust and promote belonging, then people, may be different, but there will be shared interests, and there may be ability to come together around those challenges as well. And importantly, which I know is part of what this board is really clear on, is that we really care about what our communities experience, and we care about how we show this in the actions that we actually take. There's then set out 5 inclusive approaches which are on there. Connecting, whether that's working in partnership with local people or connecting resources to be able to meet the needs of local people, that we communicate, and that's from making sure that we listen, and we listen with a view that we are actually listening to take action, not listening to tell people then what we are going to do, that we actually understand as well when we listen, make sure that we create those opportunities where we can share ideas, where we can listen to how things that we do as organisations impact on people, and we can actually use that to shape what and how we do something. Equalising, really important that we understand the power that is across our system. We understand the power that we have if we are the gatekeeper to a service. We understand that sometimes communities don't feel, and individuals don't have that power, that we make sure that we We really listen when things aren't going well, that we involve people in co-designing the solutions that they've also been part of. And really importantly, we really do understand the inequalities and we understand how they can be addressed together. Trusting, again, I've touched on this in terms of making sure that we have a relationship. A question that I often ask is, what is our relationship to communities? Because you need to understand what your relationship is and how you can build that then on trust. Trust, as we know, to be a bit cliche, is earned. It is a two-way relationship. And really importantly, celebrating, making sure that we do celebrate what's good and what's strong. We often hear, particularly, and this isn't a Kirklees issue particularly, but nationally around young people, for instance, that we hear a lot of negative narrative around young people. It is important that we celebrate some of the many positive things that we hear that our young people achieve. And we also hear that at the other end of the spectrum, don't we, often around older people, that there is a narrative. So that's really in terms of what the commitment is in the inclusive community framework. So in terms of what it has to do with the health and wellbeing strategy, just to touch very quickly on that, it has to be one of the key enablers for achieving the Kirklees health and wellbeing strategy priorities of mental wellbeing, connected care support and healthy places. For mental wellbeing, the inclusive community framework does support the idea of connecting with others and giving to others. We all know that that is a well-evidenced and documented role around mental health. We know about life satisfaction being very closely linked to social interaction and participation, and that is a real part of the ICF, is to foster that social and community life, pride in community and social connection. Healthy places, making sure that there are community activities and opportunities for people to be active, to stay socially connected. You know, there are a number of areas that I hope that you can all see where the inclusive community touches across those priorities. And it really establishes some of those really foundational elements to allow that work to happen, and really allows us to start to look at some of those root causes as well. What we've done so far, we co-produced the inclusive community framework. We've launched the toolkit and placed that on the website. We have run a great deal of briefing sessions. We've had a lot of conversations. We've been to a lot of boards. I'm always a bit anxious about coming because I know I've been a lot of places, as have staff. We've asked people to undertake the self-assessments. Many of those are still in progress. It is fair to say we have got some more work to do around that. We do have an online platform now where those are being submitted, and that idea of that self-assessment is really to make sure that this becomes a dynamic framework, that it isn't a strategy that is paper-based, that people actually take that and think about how they use it. So we've had that from, you know, a number of organisations, but particularly here, Lacala and the Integrated Care Board have completed those, and we have those. So when we get into when this first year of getting that information, the idea is that will provide us the baseline for monitoring the progress in subsequent years. It also helps us to identify some collective priorities. So it is staged in terms of it, staggered in terms of it can be from a project and a team perspective, it can be from an organisational perspective, and then it can also and will eventually be looked at from across all of Kirklees partners at the community safety partnership, and it will be to make sure that we focus on those priorities and we can coalesce all of our resource to focus on the things that we know are going to make a difference. So just to recap, The framework is a guide to how we're going to do things. The self-assessment tool, we are doing some work on this. It is a little bit clunky for some contexts, particularly strategic partnerships, although just to again celebrate some example, the Kirklees Safeguarding Adults Board have been able to do this and have held that as one of their priorities to focus and take forward. But again, we're talking to colleagues and we are doing some work around what have we learnt from people working with the framework and how do we make that better. There is, I won't go into that, it's all on the toolkit in terms of some of how we ask you to evaluate the inclusive approaches. With that, that is the bit that we need to do a little bit more work on to make sure that's relevant to as many people as possible going forward. Just want to give a few examples of where it's been adopted from the community champions, where they have used that inclusive community framework around how they get that insight into health inequalities, improving health, people's health, skills and employment. I'm afraid I've got an issue with the laptop here, something's happening. So I can't move on the slide. Oh, I'm back. Okay, sorry about that. There's also the carers lanyard in terms of how the inclusive community framework supported the identification around carers really feeling the need to be recognised and understood. So then creating that lanyard, which was a really good example. And again, these are all things that we really need to do more celebrating of where people have engaged with the inclusive community framework, and sometimes they felt they're doing this stuff anyway, which is brilliant, but also there has been some positive changes because of it. Another one is Homes England and Riverside Dewsbury were really keen to engage with us, and they have also then shared that at wider national conferences as well, so that's been really positive. I suppose in telling you this, I just want to really put forward that it is something that can be worked with. We can help you work with it, and it can make the difference that we're seeking to achieve across Kirklees with that. So I suppose some of the questions for the Health and Wellbeing Board is really, what is your role in implementing the inclusive community framework? How do you hold partners to account? A lot of initiatives come here. How do you ask? How are you assured that the inclusive community framework is supporting that? How can you use your influence? There's a great deal of influence this board has. How can you influence other people to consider the inclusive community framework? And again, how can you champion that? Just really to finish then, it is really fundamental. Feel more and more it is more important than ever that we understand the lived experience of our communities and we understand what that means for when we work alongside them to, whether that's around serious violence, whether that's around health matters, that we actually work alongside them in a way that matters to them and can actually co-create those solutions, and that they're really at the heart of everything we do. And there is always, I am convinced there is always a way, even if it's some bureaucracy, to make sure that it has that connection. So I know there'll be some conversation. Just in terms of the ICF, in terms of the next steps, we are analysing that data. We will be taking that in, the organisational data that we'll be asking for, into the Community Safety Partnership. Organisations will use it for their own priorities, but they'll also forward what are our top priorities coming from undertaking the ICF, from doing the self-evaluation. We'll then be agreeing some of those priorities, and then we'll be using that to look at training. So some of the things that we're already wanting to do that's coming back to us is making sure there's an online training package to support people, so it's not relying on people all the time, that we have some networks around people connecting to each other who are using this, but also that we learn along the way, and we make the tweaks that we need to make to that. And as I've said, we're already doing that. So quick recap, that's where we're doing. I suppose it is really back in terms of questions. The Inclusive Community Framework perhaps is asking of you, but you may also have questions to ask of us.
That's great, Joe. I was going to ask you to put that slide back up at the end. That's fabulous. So, I mean, you know, big frameworks, big strategies sometimes can get to feel a bit dry and a bit out there. But this is, you know, it's a top tier strategy, and it's about all of us and about how we can all work together. So, I mean, I'm going to ask of you, what are any of those questions leaping out at you? Are the things that you're doing that fit with this? Can you engage with it, and how can you engage with it? And have you got any questions right now? What questions spring to mind about how you would do this, how it would fit with your organisation?
Hi, Jill. I think you know that we are fairly well engaged with this. I suppose what's floating round in my mind is, how do we connect this to the work about supporting people where they live? If I think about the Darcy diagnosis, how do we make the connection between this work about people and communities and where they're living and that direction of travel? Because actually the two feel like, to me, they're fairly hand in glove together. So how do we make that real, and how we continue with that language of supporting people where they live? And it's more about health creation as well as just prevention in that space, because that feels, we have lots of discussion about prevention and what have you, but actually if we could get in the health creation space, we maybe don't need any of that. I maybe got lots more questions than I have answers, Jill, and maybe it's something, perhaps a chat outside here to work with you on. Yeah, thank you.
Anybody else got any input along that line? Yeah, Steve?
Yeah, thank you. It was just in terms of what we're trying to do as an ICB and a health and care partnership to support this. So Jill and her colleagues have been to some of our meetings previously to help kind of share this framework and encourage partners to sign up to it. We're coming back into a couple more of those forums over the next few months just to sort of touch base on where we are, what's been coming out of the learning and so on. So we're going to carry on pushing on that front. The other bit as well is West Yorkshire Health and Care Partnership are writing their equality, diversion and inclusion strategy at the minute, and one of the things they're asking for in there is that places have their own objectives within that. So we've been talking to them about that and how we don't recreate something but actually use that to strengthen the adoption of the Inclusive Communities Framework. So not quite there with that yet. That'll probably be sometime December, January, but that's the intention there, that we don't invent something that we've already got, but have as one of our objectives supporting the wider adoption and use of the Inclusive Communities Framework.
No, it's great that we can build on something that we've already got going on. There's no point in reinventing the wheel. Jill, have you got any more, the sort of responses you have, what sort of people have come on board and signed up for this so far?
I haven't got all of the detail with me, but I could provide that, and we are doing another push to get people signed up. At this point, the majority have been internal council services, and I think that is because that's where we have had a focus. We have, initially we went out to all partners, and I think some of this is about how do we collectively keep our foot on the pedal without it having to be somebody do a thing alongside somebody. And I know myself and Steve have had those conversations, and it is about how we embed that. So I think there is, I think there are points about people owning it at a strategic level and understanding what that means, versus let us try and work with what we've learnt to make that more applicable for strategic partners to hold that, so they can hold their organisation and partnerships such as this to account for making sure it's embedded. So I think there's been quite a good take up. It's been quite local authority heavy, but as I've given some examples today, Lacala, ICB have engaged with that and that isn't exhaustive. I don't have all that with me, I'm afraid.
No, that's all right. It's a clear tool there. It gives you some reflection, and that it's great that the council's getting on board. First of all, it's, you know, we've put it together, so it's really good that our services are taking it on board. Alistair first, and then yourself.
Yeah, thanks for that, Jill. Thanks very much. I think it would be really good to come along to TSL board at some time, because I think that's definitely a next stage for you, is trying to engage with the voluntary sector, especially the big players in that, and get them on board with this approach. There might be a bit more hand-holding needed, I suspect, so maybe a couple of workshops following on from that, but I think that would really help to give you a good picture of grassroots organisations and communities coming through in a different angle. So we'll have a chat about trying to get a date in for next year to come along to the board. Thank you.
Thank you, Alistair.
Hi Jill, I'm Catherine Riley from Calderdale and Huddersfield Foundation Trust. I just wondered, a Health Watch connected into what you're doing? Because a lot of it really resonates with a lot they do with us, sort of thing. Yeah.
Totally.
That's good to hear. Has anybody any other further input on that? So, Jill, I mean, I'm asking Jim Griffiths to send us out his say-so and stuff to send. Is it something that, you know, that we can send out to all the members of the board, perhaps people who aren't here, and that just to prompt them to take on board and take on? So if you've not already engaged with this, I can send you something out, and you can follow it up through that to make sure you've got that opportunity to take a look at it in private and see how involved you can get with that. But hopefully everybody could take that on board, and you get quite a further thing from. There's something we can send them, isn't there?
Absolutely, and we are really keen to work alongside external partners to the council and do that support, as Alistair has already offered that. We will absolutely do that, and also, as I said, we will be inviting a few people who have already undertaken that to come and give us some feedback about how this could be better, because it's hard doing a one-size-fits-all when it actually comes. It's great on the slides, but when you come to do it for people to make sense, that's a different thing, and it would be great to see that being I mean, my ask is that all strategic partnerships ask those questions around the same way that you do around an IIA, that you ask this around the work that is being proposed or supported at any board. Has the ICF been applied to that work?
That's great. Thank you very much, Joe. Right, thank you everybody. That's the end of the formal part of today's meeting, and since we're running a little ahead, we'll have another 5-minute break, and then we'll be coming back for an informal development session, and hopefully you can all stay for that. Thank you.